Hi friends. So today we are in a session in a webinar, Radiography 2.0, AI Advances and New Frontiers in the Radiography Careers. So in this session, we are conducting to discuss the recent trends, advances that are happening in the field of radiology and what are the new career opportunities that opens by the recent trends on AI and opens in the field of radiology. So let me introduce myself. I am Mohammed Ali. My native, I am from Kerala, Malappuram district of Kerala. Then I am working as assistant professor in Jain University of Health Science, Bangalore. Then in the meanwhile, I am helping radiographers to clear GCC exams like MOH, DHA, DOH, Prometry exams. Then I am keenly watching what are the recent trends that happens in the field of radiology and how it affects the career of radiographer, right? So we know the medical imaging system is rapidly evolving. If we are looking back around 150 years back or 100 years back, we know the medical system or healthcare system was like if you are infected any part of your body, they should to control that infection, you have to cut off that part to prevent the spreading of infection. Now, if you are thinking now in the era of artificial intelligence, robotic surgery, if you are infected any part, if you have any pathology, any tumor, any part of your body, we can send nanobots, the robot that are smaller than your blood vessels. So it will be going to your blood vessel and like it will be through blood vessel and reaching the tumor, and they'll be coming back through the blood vessel. So that like that it is evolving. Even if you're thinking a 20-year back in the radiological department, we'll be having dark rooms. So if we have exposing X-ray, if we are exposing any part, we have to take that film to process in a dark room around half an hour it will take to get the image. So we have to develop that image, we have to fix that film, we have to rinse, wash, it will take a long time. Now we have advanced technology, DR system, soon after exposing we'll be getting the image. So like that, we are getting advanced in radiology. So let's check what are the, in this session we'll be covering the trends in radiography, even CT, MRI, current trends, then what are the changes that are brought by the AI in medical imaging, then we'll be discussing 3D printing technology, then virtual and augmented reality technology, and we'll be discussing the career opportunities that are brought by these recent trends and artificial intelligence in the field of radiology. Right. So here, in DR, before long years, from around 10 years or 15 years, we are using DR system, digital radiography system. So soon after exposing the like a patient, we'll be getting the image within 2 or 3 seconds. Then even the DR system, we have automatic positioning system, automatic exposure control system, depends upon the patient size, shape, and we can set up the exposure. Even just if a patient is lying on the bed, automatically the exposure collimation will be aligned, even the cassette size will be aligned. So there are different advances in the DR. Then we have portable machines, lightweight, like a hand, lightweight portable and mobile machines are as in the image. You can like carry within your hand, like that portable machines are available in our departments now. Then we have AI in radiology. Let's see how the AI in radiology or AI in X-ray works. See, here we have an image. So the AI system will be having a lot of data. So we're having a normal and abnormal X-ray. So if you given a abnormal image to a DICOM, automatically the system will detect the abnormality. If any abnormal image is given, automatically the system will detect what it is, whether it is a tuberculosis or a pneumonia or a thrombolization, anything. So soon after giving an image to the DICOM, the system will detect what the abnormality it is. So that's the AI in radiological image or X-ray works. That's the way how AI works in X-ray images. Right. Then if you're coming to CT, we have several advancements in CT. Most of the departments having spectral CT. We can go this is 6th generation CT. Spectral CT in the sense will be having dual source mechanism. Either will be having a single source dual energy or a dual source dual energy, dual source X-ray tubes or
In the X-ray tube itself, will be having two cathode ray films, cathode films. So it gives better spectrum. It gives two X-ray photon spectrum for imaging, and it gives better tissue differentiation. With a small amount of contrast, will be giving better enhancements in CT, dual energy CT. We can call it as spectral CT or dual energy CT. So it like in cardiac imaging, even in stent detection, even in renal imaging, calcium separation. We have a lot of applications are there for this spectral CT. That is allows separation of different chromosomes. So if you're having a better like tissue characterization, if you're using spectral CT, then we have so the spectral CT having improved very nice image quality. We have better spatial resolution. Even we have better temporal resolution. Scan time is very less, and the radiation dose is very minimal. So before we used to say a chest X-ray, a CT scan of head, it will be around. It gives exposure of 100 chest X-rays. So now it's not like that. It will be the radiation dose is very minimal in new generation scanners. So they are like will be around 2-3 X-rays exposure only will be there for spectral CT scanners. So you can see the image quality. It's very will be having better spatial resolution and temporal resolution. The scan time will be very less and will be having a high pitch for the scanners. Then we have Risen technology. In India, we doesn't have the technology, that is photon count detector CT. In our department, we are using singulation detector CT scanners. Singulation detector CT scanner in the sense they'll be having a singulation crystal on the detector. If the X-rays are exposed, that they will be converting them into light later to electrical signal. Here, the photon count detector CT or quantum efficiency CT. I think you have heard about quantum efficiency computers, quantum TVs. So how you work in the sense they directly convert that X-rays into electrical signal. There will not be any light transmission. So we'll be using of maximum energy and will be having a threshold. They will not use X-rays having low energy and a higher energy. There will be a threshold will be there. So radiation dose will be very minimal in photon count detector CTs. Now in India we don't have photon count detector CT. Dubai and all, they installed some hospitals have photon count detector CTs. Soon in India also to be coming photon count detector CTs. They use apart from the in singulation type of they use singulation crystals. Here photon count detector CT use cadmium telluride crystals. They convert the X-ray photon directly to the electrical signals. So scan time will be very minimal, and along with the spectral, combined with the spectral CT, so we'll be having very better image quality, and they'll be counting the X-ray photons coming from the patient coming after attenuation. Then so we'll be having better image quality, and will not be having any beam hardening artifacts because they're having a threshold. Under the threshold, they will not be taking any low energy X-rays, so radiation dose will be very minimal. Then no need of giving, even it is working with the spectral concept, so will not be having, we don't need to give a much amount of contrast. Right. Then the applications of this photon count detector CT are very well. So it's a cardiac coronary angio. You can see the stent. Tissue characterization is very good tissue characterization. They hiding even the stent. We can see the stent here. So it's a very better spatial resolution, and we'll be having better contrast resolution. Even iodine tissue characterization will be very good in the spectral and photon count detector CTs. Even they have applications in musculoskeletal image. Yes, right. That's about the photon counting and spectral CTs. Then along with the spectral CT or in the photon count detector CT, now we are going to see how the AI helps in CT imaging. See, if you've done a thoracic scan or a trauma patient, usually you have to count if you're having any fracture in the ribs, you have to count the rib manually. So here now new generation scanners, 6th generation, enabled with AI, they will be having automatic rib counting, automatic vertebral counting software. So with a single click here, you can see the count, they are given the counts. Hope it is visible, 2, 3, R1, rib count is given. So by use of AI, with a single click, there is no need of manual counting. They'll be giving here, you can see the 4, 5, 6, 7, 8, and numbering and coloring is given. So that's the AI application of AI in CT image. Then similarly, you can use the same technology to for the vertical count, C1, C2, C3. So with a single click, you'll be getting vertebral and rib count. These are applications of AI applications in CT imaging, right? Then we have automatic stroke detection. How the AI works in X-ray in detecting tuberculosis or pneumonia, like that. In stroke CT brain scans, we can use for stroke detection. So it works with the AI. How in a sense, we will be having a data of normal brain scan. So it will be giving attenuation values to the processor. So if we found, we know the stroke of the ischemic stroke will be having attenuation range around 20 or less than 20 HU value. So if it detects automatically, the system will be giving a signal. Here we have the stroke or ischemic. In fact, even the bleed detection softwares are there enabled with AI. Then a lot of like even tuberculosis, even pulmonary embolism detecting softwares are there. They are enabled with AI, so they will automatically they will giving signal where they were having stroke, where we having tuberculosis, where we having pneumonia, where we having lesions. So automatic they'll be enabled with the packs. So within the clicks, they'll be automatically detected. If we are having any stroke or hemorrhage in the CT scan, they'll be automatically giving the signal where we'll be having that ischemic impact. See, here the normal scan may not be able to detect the if it is acute stroke within the window period, we will not be able to detect in the CT scanner. Only after 6 hours only we can detect the ischemic stroke. But by enabling the automatic detection, we can get the stroke detected by use of AI, even 6 hours before, even the 6 hours after starting the symptoms, right? So it will be detecting the automatic detection of stroke, and then the blood will be marking the blood vessels where we have the stroke, right? Then we have, along with we have lot of post-processing techniques are there in these 6th generation spectral CT scanners. One of them is cinematic volume rendering. We have volume rendering in our scanners, or a VR technique. So the most advancement in volume rendering technique is cinematic volume rendering. So it will be image quality will be having like this, very better spatial resolution and better contrast resolution. So a cinematic, we have cinematic effect in our iPhones. Like that, we have cinematic volume rendering. It's a new post-processing technique in our spectral scanners. All right. So 3D space view, we'll be getting an image like this with a normal CT scan. Then we have 3D printing technology. So resin technology, 3D printing, have a wide application. So for maybe with that DICOM data, we'll be converting them to 3D model. They use for implant making. Even if the surgeon get an actual replica of a of the part we are scanned, then will be used for surgeon will be having easily access. Like they can easily plan the surgery if you have actual replica of scan. So have application, even it can apply in implant making. If you have actual scan, like the scan data, the DICOM data will be converted to 3D model, and we can print to make knee implants, ankle implants, even for if we have non-functional organs like ear, external ear. So we can make 3D models by using DICOM data or CT images. We can print the normally we'll print in 2-dimensional plane, will be X and Y plane. 3D printing is we are printing in X, Y, Z plane. That's the way how it works. 3D printing technology. Right. Then we have recent advancement, that is virtual reality and augmented reality. So virtual reality and augmented reality, how they are different. Virtual reality is nothing but if you have like complete immersion of 3D environment, that is virtual reality. If you're using a virtual headset, and then that device will be taking into a complete another universe, that is virtual reality, complete non-real environment. Then augmented reality is nothing but the mixing of reality and three-dimensional virtual space, that is augmented reality. So they have wide applications like we have wide applications in the teaching education side. So if for teachers, they can use, for students, they can use this headset to teach anatomy, even the scanners, like we can use, no need of having a cadavers in the anatomy, no need of having and just a skeleton. With the virtual, using virtual reality, they can have a look at anatomy of the, even to study the CT anatomy, MRI anatomy, they can use virtual reality. Then augmented reality. Augmented reality, so there's a mixing of virtual and real space. So the virtual image, so if you're planning, if a patient is on a surgical table in the theater, so we can have a scan of the patient on the and we can place it on the patient body. So the surgeon will be easily can detect where they have to puncture, where they have to cut the vein. So they'll be very easy. So the mixing of virtual and real and unreal world. That is augmented reality. So soon will be coming into radiology, it's a recent trend, right? Yes, right. That's virtual and augmented realities. So that's about the recent trends, technologies that came in recently in CT. Then while going to MRI, we have high field MRI systems. So they'll be giving better spatial resolution image and high quality images that we applied in neurological and musculoskeletal imaging. Even we have some safety concerns while using high field MRI. Then soon we can expect in our department also we'll be getting high field 5 Tesla, 7 Tesla MRI scanners. Then one of the recent technology is helium-free MRIs or dry technology, dry MRIs, right? Zero boil MRI or zero helium MRI. So now in our MRI scanners, we are using helium as a cryogen. Why we are using helium as a cryogen? As a cooling agent. So around 2,000 liters of helium we are using to cool the magnetic system or the bore of the magnet. So if you have something is stuck on the MRI machine, we need to quench the all helium, and the helium is very costly. To refill that helium, it costs very high amount and it's very costly. So that's what was the limitation. So if you are pressing a quenching, we'll be thinking multiple times, am I able to do the quenching or not? So here new technology came. There doesn't need much helium. Only 0.7 liter helium will be enough to cool the whole magnetic system. So if we are pinching the quench button, the helium gas, 0.7 liter helium gas will be converted, helium liquid gas will be converted into a gaseous state. After some time or half an hour, it will be coming back to liquid state. So they will not be losing helium from the machine. So there will not be, this kind of machine will not be having any quench pipe. So the cost of the machine is very less and will be simultaneously the scan will be less and will be having better image quality also. In India, last month, first helium-free MRI is installed, right? So that's about the helium-free MRI. Then we have air coils. Air coils in the sense they are very lightweight. The patient will large coils on the patient body. They'll be having a discomfort. So to overcome that, air coil technology is there. Air coils are ultra lightweight MRI coils. So their gap between the patient and the coil will be very less. So we'll be having the reduction, noise reduction will be there. So having better image quality. So that air coil technology, lightweight coils that can be used in MRI. Right. Then we have functional MRI. Functional MRI in the sense they have applications in the neural imaging. So like if it's useful to assess the brain activity. Brain activity in the sense if a patient had a stroke, a paralyzed patient. So will be now we have to check the brain activity. We'll be giving some command to the patient to assume that if the patient is having a right side paralysis. So we'll be giving a command to the patient to raise their hand. So at the time we'll be checking whether the brain in that particular area giving neural sensors to the hand, whether it is active or not. Then with that data will be used for the prognosis and for the treatment planning. So that's the way how functional MRI works. They use bold sequences, blood oxygen level dependent sequences to get the brain activity. functional MRIs. So recent technology, they can track the thoughts of the patient while doing MRI scan, functional MRI. So it's used to assess the brain activity. Right. Then we have automatic selection and positioning techniques even in MRI and CT. See, the planning and the positioning is very hard to in MRI. So here, by using a camera system in the bore, they'll be automatically detecting the anatomy. The camera will be detecting the patient. If the patient is lying on the table, automatically the camera system in the MRI machine will detect the anatomy, and automatically patient will be moved to the ISO center. No need to keep the patient in the checking the laser or nothing like that. Just the patient, we are placing the patient, then automatically the system will move to the ISO center. Automatic planning will be automatically positioning, and later planning will be also automatic. Now we know, those who are working in MRI, how difficult to plan a brain. First we have to do axial planning, then we have to do coronal planning, then we have to do cervical planning. It's very hard. So now we no need to do that plans. New generation scanners, MRI scanners having, if you are setting the protocol, by clicking a single click, automatically the scan will be done. Just we have to check whether there is any movement or not. Even this type of scanners are there in our Kerala, in India, a lot of scanners are there, or having automatic scanners. So with a single click, they'll be doing all. Within 20 minutes, patient will coming out. Nothing to do, no planning, no positioning, nothing. Just automatically the system will do all scan. So that even some of them are working in this kind of scanners, right? AI-based automatic planning and positioning system. Then we have automated cine, accelerated cine imaging. In that application is cardiac MRI. So by using this deep learning accelerated cine imaging, we can complete a cardiac scan in single RR interval. Those who are working in working MRI, if you are doing a cardiac scan, we know it's very hard to. The challenge in cardiac scan is temporal resolution. To complete the scans, it will take long time. So with the using deep learning accelerated cine imaging Fiesta sequence, they'll be having, we can complete that scan within single RR interval. So the scan time will be very minimal and be having better temporal resolution. So that's the accelerated cine imaging. Then we have AI-based artifact reduction technology. So the same way how it works is the automated detection of stroke. So we'll be having a data of normal scan. So anything noise comes, automatically the system will detect and will remove the motion artifact or any artifact, and will be giving the final image. So here we can see the artifact automatic detector, artifact detected images in the right side. So that's the application. So these are the lot of AI-based technologies or recent trends in CT and MRI. Then going to the next session, the career part. How will be the radiology career? How is there any new chances? And we are going to see. So if you have any queries till here, let me know in the chat box. Now we are going to discuss we didn't complete the session. Now we are going to the next section, that is career side of radiology in the the era of artificial intelligence. I hope it is clear. So we'll be having a confusion like, if the technology comes, how will be our career? If we are automatically positioning, automatic scanning is there, then what's the purpose of a radiographer? Why we need a radiographer? So nothing like that. We have a wide range of career opportunities, not just then in every we have a lot of colleges. From every college, like 120 or 150 radiographers are coming out every year. So we'll be having confusion like will be a competition will be more tight. So nothing like that. We have a lot of career opportunities in the radiological field. So we know we have CT experts, MRI expert, then sonograph. Even in India, we cannot work as a sonographer, but in abroad, sonograph we can work as a USG scanner. Then we can have a CM technologies, operation theater technology, like even we can work in cardiac cath lab. So then, so these are all we all know. We can work as CT radiographer, MRI radiographer. Apart from this, we can work as neuroradiographer. So as like we have, if you have any, if you got any disease, you'll be going to, if you have any headache, you'll be going to specialized doctors. As like, if you are expert, you are skilled in neural imaging, CT brain, MRI brain, then perfusion, spectro, all that, you can work as neuroradiographer. In UK, even in abroad, they are hiring specialized radiographs, neuroradiographer, like then pediatric radiographer, cardiac radiographer, geriatric radiographer. So you have to be specialized or skilled in, as per your interest, you have to be skilled. Then only you can survive in this competition. So neuro or a pediatric or ortho, cardiac, so a lot of chances. So Euro hospital, they'll be hiring Euro radiographers. Then ortho radiographers, for ortho hospital, they'll be hiring only ortho. They doesn't need any neuro radiographer. No need to be like knowing everything. Just specialized urologist, they should be skilled in to do CT urograms, MR urograms. They should know perform how to do IVU, MCU, and all. So that uroradiographer. Then ortho radiographer should be skilled in doing all like special views, all extremities, even extremity MRI, CT scans. Then pediatric radiographer should be trained and skilled in to do how to deal with the pediatric patients and handling with patient care. And so we can work as expert radiographer without specializing in a particular area. We cannot survive in this competitive field, right? Then, so uroradiographer, orthoradiographer, pediatric radiographer, and neuroradiographer. More than that, then cardiac radiographer. Then, if you are not interested in clinical side, you can work as in drafting radiographer, reporting radiographer. Reporting radiographer in the sense, in teleradiology, and radiographers only will be like preparing provisional reports. So you can work as reporting radiograph. Even in India, there are career chances there as a reporting radiograph, drafting radiograph in teleradiology. Even hospitals will hire in UK and even in Dubai. They are hiring. Even in Canada, you have a chance of reporting radiograph. So you should have a better idea of a pathology to work as a reporting radiograph. So if you find any abnormal, you have to report that. You have to make the provisional report. Then later the radiologist will be checking the your report and getting given sign. So that's a drafting radiograph or reporting radiographer. Then you can work as radiation safety officer. So even after diploma, the ARB will be giving training for to become an RSO, radiation safety officer. So that's another chance. Then you can work administrator after your radiography career. After radiography course, BSc or MSc, you can do a MHA or MBA. Then you can manage. You can work as radiology manager. Then radiology manager after doing your BSc or MSc, radio MIT or RIT. You can do a management course, MBA or hospital administration, MHA course. Then you can be the head of a radiology department. Then if you're skilled in that, even you can be a administrator in radio, or like a hospital you can control, managing side. So that's another career opportunity. Then research check, you can work as research expert. So most of the companies, vendors, CT, MRI vendors like Siemens, GE, the R&D team will be the research and development team. So research and development team will be, you can work as research radiographer too. Research radiographer in the sense they will be doing research too. Studies will be there. So they'll be collecting data. At that time, they'll be doing CT scans, MRI scans as a part of research. So they'll be hiring radiographs to do research. So even UK, in India and abroad, we have wide chance of research radiographer. Those who are interested in research, they can go for as a research radiographer. So even should have a problem-solving skills to become a research radiographer. So those who are interested in research, they can go for research radiography. Oh, that is not, you need to get a higher study, even after BSc, even after diploma, you can work as research radiographer. You have to clear their skill set. That's it. So that's the research radiography. Then if you are interested in teaching in academic side, you can take MSc, or even after that you can go for PhD. Then you can work as teaching or tutoring side. So that's also a very good career opportunity. You'll be in India, you'll be getting better pay in teaching side, even in abroad. So then other expert roles are application specialist. So as we said, vendors, Siemens, G, Philips, they have application specialist jobs are there. So application specialist, in the sense we have wide chance are there. So if you are interested in engineering side, you can go for the application side. Then in application specialist, we have different specialist. If you are product specialist will be there, you can work as product specialist, even clinical educator, even work as a marketing expert. How in the sense, product specialist means you'll be dealing with only one product. So if you have, they'll be giving training on that product. So you'll be doing research, and you'll be dealing all details of that particular product. Say, for example, Siemens Somaten Goto. So you'll be expert of that particular machine, and you'll be giving a particular machine. Then clinical education in the sense, for clinical education, you should have good communication. So communication skills. So you will be teaching radiographer coming to it, how to use that particular machine, how to use that software, how to use that workstation. That's like the clinical education. The application specialist, you can work, especially if there be product, you can work in if you have a communication skill, conferences, going to departments, like if you have a machine or Siemens or any machine, you'll be giving talk in conferences. They'll be putting stalls. So you have to market that particular machine. So these vendors will be hiring. Those radiographers only can explain the technical side and even how the application. So they'll be hiring radiographers or marketing experts. A lot of radiographers are working in India in Siemens, G, Philips, even Samsung as a marketing expert. Those who are having a good communication skill after radiography career, you can go for marketing expert, application specialist. Then as cath lab expert, like in cath lab, even cardiac cath lab, radiographers are working cardiac cath lab, even in radiography cath lab. So radiation exposure will be little less, little more. Then, but better pay, better, like if you're interested in live imaging surgeries and all, you can go for cath lab technologist. Then if you are like if you have a financial background, then you can make you can start a diagnostic center. Then licensing, like you can can do work as a licensing expert to get help the owners to get the license for the radiology diagnosis centers, X-ray centers, USG centers, and all. Then PACS administrator, you can work as a PAC administrator, controlling the tele system and all. Then right. Then just we'll see how the teleradiology system works. We have a wide opportunity in the teleradiology system. Let's see how the teleradiology system works. So if the patient comes for a scanner, either CT or MRI scanning the hospital, they'll be doing the client or the hospital. Hospital is a client, so they'll be doing the scan, capture, they'll be collecting data. Then they'll be sending the computer. Then wherever, then we can send that data to teleradiology system. We'll be uploading the client or your client or the radiographer will be uploading the images or the DICOM images to the PACS or the teleradiology software. Then wherever you are, you can access that image and you can give to the doctors to report that. So here comes the radiographer role. So if even here, from after seeing this image, if you have done a normal NCCT abdomen, then you have to give the radiographer in the hospital to which protocol they have to follow for contrast. We have different abdomen scan, abdominal protocol, urogram, triple phase. Then we have to instruct how much contrast we have to give. Then like which arterial phase is you have to take, or a venous phase, or if it is a abdomen thoracic scan, whether HRC is needed or not. Like that, this radiographer from the tele system will only giving instruction for radiographer. Then he'll be assigning radiologists to give the reports. Right. Then he'll be sending to the hospital for dispatching the report. That's the way how teleradiology works. So if you are like to work at home, you can choose a teleradiology career. Even by sitting in a home, you can work as a teleradiology expert or a teleradiology radiographer. You'll be getting a better pay. So for that, you should have a better anatomical knowledge. Then you should have a knowledge to set the protocols and all. So it's a nice, good career, better pay, teleradiology radiographer. If you are like concerned, some will be having, I'm not like to work with the patients, then you can go for teleradiology. Right. Then moreover that, we can, a lot of career opportunities are there. If you are experienced or more 10 years or 15 years or even 5 years, you'll be having a lot of connections, network with the doctors, diagnostic centers, different radiographers, even with application specialists, even with the vendors. So you'll be having, I think those who are in Kerala will be knowing the restaurant consultants, food bloggers like Mrinal, Basim, like they are not just the food bloggers, they are restaurant consultants. What they do, they'll be helping to start a restaurant. They'll be doing market study. They'll be setting menu. They'll be hiring chef, staff for a restaurant. Like that, you can help doctors or those who want to start a diagnosis center. You can set the market study, and you can guide them to which modality of machine you have to choose, which machine for after market study, which MRI machine you have to choose. You can help them. Then you can set the rates of the scan. So the radiograph. So if you are expert, then you can connect them with the radiologists and vendors. Then so you can work as a consultant. If you have a wide network, have a nice experience, even you can draw the layout, how to start room, how to set up MRI room, how to set up room, how to set up knowledge as imaging consultant or diagnosis center consultant. Ando, Mr. Ando, sir, the founder of Radblogs, it's a kind of consultant. If you have experience, you can work as a consultant in imaging diagnosis centers or hospitals. Right. Then you have wide opportunities in GCC countries, Saudi Arabia, Qatar, Oman, Bahrain. A lot of opportunities are there in, not only in the wide opportunities for radiographers in UK, in Singapore, and then Ireland. Also, the next, a lot of healthcare workers. So there's a wide chance in African countries. Then for that, you need registration. For UK, you need HCPC registration. To work in Ireland, you need CORU registration. To work in Australia, you need HPRA registration. Then for working in Canada, you have to attend CMRT exam. Then so registration is needed. So if you need any assistance, simply my team will help you to register for the registration on GCC exams. Right. So for working in GCC country, you need to attend exams, MOH, HARD, DHA, and some. If you need any assistance, Medline team will be simply my team will be helping you for that, right? So you can conclude. So even in the we can conclude the session of technology is getting advanced. The rates are even we have wide opportunities. Then in software companies, the system-based software companies will be hiring radiographers to teach their AI. So then, so if they are starting data collection and have to get the pathology. So you can work in AI software companies. They are hiring radiographers to identify the pathology. If you are able to identify the pathology and with anatomy, you can work in software companies as a radiographer. So your role will be you have to identify the image, and if any pathology is there, after checking the data, you have to give that which pathology it is, whether it's a stroke, or whether it is a bleed, or whether it's a pulmonary embolism, whether it's a TB, whether it's a pneumonia. So even in AI software companies are hiring radiographers. So the AI is not like a threat to radiographers. It's actually an opportunity. With the help of AI, the career opportunities are getting more wider. Before we are working as CT technician or MRI technician, X-ray technician. Technology is getting advanced, so opportunities are getting more. So even I have to give a conclusion, like a message to give at the end of the session. Even you have to take care of this patient care part. The technology is that there is something that technology cannot give. Positioning, planning, and automatically we can do. But empathetical care or patient care side, that machines or AI or robots cannot give. That only a human can give. So if along with that, like we have to take that AI and the empathetic care hand in hand. Then only you can survive and in the era of artificial intelligence. If not, you will be thrown out of the career. So, like that QA session.
If anyone has any queries or doubts, you can address in the chat box, or you can just unmute and ask away also. Thank you very much, sir. Thank you very much, Ali sir, for the very wonderful and very informative session. If anyone has any doubt or anything, you can ask away right now.
Yes, Sharad, any about reporting area, what is the most I interested? So for getting, which should be the best. So we cannot say something is best or something is not good. So it depends upon your skills and your interest. That's important, your passion. So if you're interested to work as a radiographer, you want to deal with the patients, then that's good for you. If you are not interested to deal with the patients, you can go for as well if you are interested in technical side, like application side, you can focus that. So we cannot say which one is better. So as it depends upon your skills and interest. Then reporting area, what is a master I need to study? You don't need to study a particular course or something. You have to be skilled in reading scans. If you have a skill to identify the pathology and the anatomy, that will be enough. Even after diploma, you can work as a reporting radiographer. For going abroad, and they'll be asking a degree, basic BSc degree. I hope I answered Sarah's question then. RSO. So RSO, Radiation Safety Officer, there's a different RSO careers are there. If you're working as a nuclear medicine RSO, they have to clear RSO exam. Then even some department, if you have experience, they will select you as a RSO. So then for that you need just experience, no need of exam. So that RSO is different. So you call him RSO only, but there's a difference in that. So after your BSc MIT, you can take a MSc Medical Physics. Then you can work as medical physicist after MSc. Then if you are taking RSO, if you have to clear ARB exam, then you can work as RSO as a medical physicist. But in our department, we have RSO standard. That's different. No need to clear exam. ARB will be giving training for that. So different RSO does there. Even if you want to help, last month in October, last RSO exam was there. It will be held in Mumbai. Then see, we could elaborate on RSO, higher studies we can choose. So after BSc, if you want to work as RSO, after BSc, you should study MSc Medical Physics. Then only you can write RSO exam. Or nuclear medicine technology. So if someone is there in the nuclear medicine or radiation therapy, after MSc, they can directly write RSO exam. You don't need to study MSc separately. After BSc in nuclear medicine and after MSc radiation therapy, directly you can write RSO exam. I hope I answered Sylvia's query. Then thank Rajamani sir. Anything more? Then if you have any queries later, you can get touch with the SimplyMed team. We'll be guiding to passing the exam, GCC exam for registration. So even we'll be having sessions. I think Iba ma'am will be mentioning about that. Iba ma'am, you can take over.
Okay. The upcoming webinar will notify you. Okay. So I think that's all with the queries and all. Does anyone have any more queries? We'll be providing a feedback form, so you can put in that also. So that's all for now. I hope everyone had a great time, and thank you, Alistair, once more. Thank you.